Hi, I'm Robbie Freeman. I'm our Vice President for Clinical Innovation, and I want to say a big thank you to all of our nurse innovators out there. Throughout the course of history, nurses have led the way with healthcare transformation, and from the days of Florence Nightingale and other nurse leaders, many of the most instrumental events in healthcare have happened thanks to nurses. And so today we're going to hear from some of our nurse innovators from across the health system who are solving really important problems that are helping us keep patients safe and enhance the nursing practice and care that we deliver every day. We're able to create algorithms that can comb through medical records and discriminate between who are the patients heading towards an ICU or needing a ventilator, and who are the patients that are heading towards getting ready for discharge. These tools help give insights to the clinical team and give us a sense of the trajectory for these patients.
Generally, emergency departments are built and designed to care for a few critical patients in a specific area. During COVID, we found that we were taking care of critical patients throughout the entire emergency department. During the first surge of the pandemic, a lot of ideas started populating around how to create containment devices to control the spread of COVID. So essentially, my notion was, how can we create something that would really control the spread of aerosolization and create negative pressure systems at the spur of the moment, and then something that would you could take off very quickly and dispose of very quickly. So that's how the notion of creating this essentially this pop-up negative pressure containment device that was disposable, that prevented the spread of particles, that was specifically designed for resuscitation came to be.
During COVID, when we first started and we started getting patients in, we noticed that, wait a minute, all the doors are closed. We can't see any of our patients. And that's something that I'm not used to, the nursing staff wasn't used to. And then, that kind of got us thinking, what can we do here? What can we do to really get to see our patients, connect with our patients? So I spoke to one of my nurses who used to work in a different field, and I said, let's think of how we can get donations. Let's call people who are into video, camera. Can we get some cameras in the room? So Google Nest wasn't actually the first thing we thought of. We were just trying to get any camera we can think of. And then Google Nest came about, and Patrick came to me and said, hey, we've got these Google Nest cameras that are being donated. And I said, well, this is great. So it kind of fell in line with what we were thinking.
So here at Mount Sinai, the care we give is relationship-centered, and we take great pride in enhancing the patient experience. Right? So under the auspices of the Department of Clinical Innovations, we introduced the MyChart bedside, which essentially gives patients access to their charts, and then they're able to see their records, they're able to see lab results, they're able to see interact with the team. It kind of gives the autonomy to the patients, so the patients are able to feel involved in the care that is being given to them.
I've started an admission assessment for the patients to do. So when the patient is admitted, they can actually start putting their information into the tablet, and it decreases the amount of workload for the nurses. So the data entry that's associated with admission assessments are done by the patients now, and it's more accurate. Also, there's patient education that's available to the patients at the tablet. So if patients have questions about certain things of their care, medications, how to do things like the CHG bath wipes, which prevents collapse, it's all available to them in the tablet. All of these things that we're doing in clinical innovation helps the nurses and also help improve patient outcomes.
So you've heard from some of our nurse innovators from across the health system, and now we'd love to hear from you. Please send us your big idea.